Good evening, everyone. This is County Executive Mark Molinaro. Thank you for joining our telephone town hall. We're going to spend some time this evening talking about Dutchess County's response to COVID-19, take a chance to answer some of your questions. Let me let you know that you're joined here at the county office building by the Commissioner of the Department of Behavioral and Community Health, our health department, Dr. Anil Waidyan. Dr. Waidyan comes to us, obviously manages the department with over 20 years of experience one way or another in infectious disease, and we're grateful for his leadership. At the same time, I want to let you know that we're joined by Commissioner Dana Smith. Commissioner Smith, Dana, oversees the Department of Emergency Response. So thanks for joining us this evening. We appreciate it. Again, I'm Mark Molinaro. We're going to spend some time talking to you tonight a little bit about our response to COVID-19, but also, as importantly, give you an opportunity to ask some questions. So if you have a question, hit 0 on your phone. Be given an opportunity to record. Obviously, if you'd like, comment on Facebook, and we'll pull some questions up. So let's talk a little bit about tonight. This is a telephone town hall. You and a few thousand of your neighbors are participating. We're grateful for that. As you know, several weeks ago, seems like an eternity ago, but approximately 4 weeks ago, Dutchess County, like communities all across the country, began to respond to what was emerging as a public health emergency. COVID-19, coronavirus, of course, moved its way across the globe, and ultimately we started to see cases here in the United States and in the state of New York. For 3 weeks ago, Dutchess County saw its first positive COVID-19 case, and I'd like to talk a little bit about what we did in preparation. The county's Department of Emergency Response and the staff within our emergency response apparatus in county government prepared for and was prepared for, well, any emergency, but in this case was monitoring cases across the globe and preparing for a public health emergency. Several weeks ago, we activated that response. In essence, our pandemic response team that includes leadership from many departments throughout county government, good, decent professionals who spent a great deal of time preparing for, monitoring, and upon our first positive case, responding to COVID-19 here in Dutchess County. As we speak tonight, there are nearly 30 identified positive cases, but I want to talk to you a little bit about what that does and doesn't mean. First, I think you recognize that the number of cases doesn't necessarily reflect the number of individuals who are living with COVID-19. The truth of the matter is we as a society, and certainly we as a community, have transitioned, if you will, over these last couple of weeks from monitoring individual cases specifically to really talking about the fact that we as a community should understand that all of us, in one way or another, has either contracted COVID-19 or come into contact with somebody who may have contracted COVID-19. And it's important to think that way, because if we function as a community as if we're carrying the virus ourselves, we'll make the choices in our lives that will help us drive down the number of transmissions. So emergency response, and Dana would tell you this, emergency response in any situation begins locally. And when the demand exceeds capacity, the response expands to the next layer of government and the next layer of government. In this case, a public health emergency begins in New York State with a response by the Departments of Health across New York. We become the point of contact. And working with local emergency responders, municipalities, and healthcare organizations, we assemble and respond to what ultimately is this public health crisis. So I want you to know that we activated our response some weeks ago. We've been overseeing and managing that response, a real full force of professionals throughout county government functioning 24 hours a day, 7 days a week. We've been working hand in hand with supervisors and mayors across Dutchess County, colleges and universities, our public schools, in fact our faith community, and public healthcare organizations and institutions across Dutchess, working every day to obviously identify and respond to those who have been identified as positive cases, but also to work to care for those who are ill. As we talk tonight, I want you to know that first, in our response, we issued a series of emergency orders. Dutchess County is in a declared state of emergency. And that state of emergency provided the county executive the opportunity to issue a few emergency orders. Those emergency orders, as you know, we acted in concert with Orange, Ulster, and Dutchess counties collectively. First, requiring school closures throughout the community. Second, allowing us to suspend certain government operations, and most importantly, allowing both municipal governments and the county government to assemble the resources necessary to respond. Subsequent to that, as you know, Governor Andrew Cuomo, in concert with the states of New Jersey and Connecticut, took some additional actions. Even as current as today, earlier today, the governor continued an effort to try to limit the amount of social interaction we have in order to minimize transmission. Those orders today collectively include closures of restaurants, bars, movie theaters, gyms, public amusement businesses, and bowling alleys and things of the like. Open spaces at malls, no closing malls at the end of the week. All of these steps are meant, I know how burdensome and intrusive they are, but they're also meant to limit our interaction in order to drive down transmission and prepare the public healthcare system for what is an increased demand and use. So before we start taking questions, I want to just cover one last bit of information. If you're out there trying to find real information about what we're doing and what you should know about COVID-19, you should visit dutchessny.gov. dutchessny.gov/coronavirus allows us to provide you updated information. Please follow us, Dutchess County Government, on Facebook and Twitter, where there is up-to-date and accurate information. It's very important that we provide you information that's sourced and consistent and that you can rely on as being accurate. So dutchessny.gov is the place to go for updated and accurate information from county government, and that information is mostly sourced through the CDC, the World Health Organization, and the New York State Department of Health. At that website, you'll find some opportunities to reach out. The county activated an information hotline. That hotline is at 845-486-3555, 845-486-3555. That hotline is available for you to ask questions and to get some guidance. I also want you to know that later in the week, we'll be announcing the launch of a coordinated effort to provide food assistance and help to those seniors and others who might be shut in. That response, Dutchess Responds, and you'll start seeing that Dutchess Responds will be a coordinated effort among a group of not-for-profits. It'll also be a clearinghouse, if you will, of activity that's underway all throughout Dutchess County. Good community members, churches, synagogues, fire departments, others who are all trying to be of some help to so many families we know that will struggle through this experience. So Dutchess Responds will allow you to donate, in fact, and also donate funds if you'd like to support those efforts to purchase food, goods, and other items for those who will be in need. You'll also be able to volunteer, and we'd encourage you to visit dutchessny.gov /MRC, dutchessny.gov/MRC, Medical Reserve Corps, MRC, to sign up to volunteer, and there'll be opportunities like that, opportunities for you to do so. And then lastly, I just want to mention that we're going to try to institutionalize regular updates for you. We're in regular conversation and regular conference calls with the community leaders and business leaders and others. We want to make sure that you have an opportunity to stay up to date. So every day you'll in fact see at the county's Facebook page a regular update of information. You can see a video that updates that information at Dutchess County Government on Facebook. But once a week we're going to do a live exercise. So either it'll be a live telephone town hall of this nature, or we'll do a live town hall on Facebook for you to review. So if you have a question, hit 0 on your phone. This is County Executive Mark Molinaro. Why don't we start with one of our Facebook questions to get things started, and then Chris, you're going to find another one to follow up with. So Valerie is asking, can you confirm small businesses are eligible for Small Business Administration emergency loans? Also confirm if it's for economic impact. Well, Dutchess County is one of 3 counties in the state of New York that has been approved for SBA loans, Small Business Administration loans. You can get to that information at duchessny.gov. That is to assist in. Now these are loans certainly, although the federal government is talking a little bit about outright financial aid and financial assistance, but those small business loans are available for economic impact, and you should visit duchessny.gov, and we can get you to that information. Chris, we're going to go to a question. Who do we have on the line? Matt, why don't you go ahead with your question? This is County Executive Mark Molinaro. Go ahead.
Hi, County Executive. You kind of answered my question. I just was wondering if there were other ways for people to volunteer and help out in this situation. I know Ulster County has people volunteering at the call center to kind of answer questions and field them. Didn't know if you had something set up like that in Dutchess County as well. But you kind of answered something.
I kind of did, but you know what? Let me offer you a little bit extra information. Just when we refer to the Medical Reserve Corps, that in fact is a county-instituted volunteer apparatus. We have dozens upon dozens of volunteers across, hundreds upon hundreds of volunteers across Dutchess County, who have particular backgrounds that they lend to us in case of emergency. So first we initiated our hotline at the Department of Behavioral and Community Health with staff and MRC volunteers. So we already had that network in place, but if you visit duchessny.gov /MRC, you can sign up to be a volunteer yourself, and there'll be opportunities to volunteer on the hotline, there'll be opportunities to volunteer in the distribution of food and goods, or even volunteer at any number of shelters or food pantries across Dutchess County. So duchessny.gov /MRC, and you can be a part of Dutchess Responds. Dutchess Responds will be our effort to coordinate both financial and food, goods, and services. And it's a good opportunity for me to remind you that, listen, the impact of this, of course, is on all of us. Many of our small businesses are struggling. The executive order, the emergency order by the governor, still permits restaurants to provide food service via delivery, takeout, or curbside. So if you have an opportunity where you need food or you just want to show your support, you can take that chance to support one of your local businesses. And there are numbers of businesses across Dutchess County who are still operating. This is an opportunity. Maybe you want to buy a meal for a neighbor or yourself or a friend if you can afford to do that. And with that, you'll be supporting that local business. And we'll also, there are communities all across Dutchess that are trying desperately to make sure those opportunities exist. Doctor, while I have you here, before we take the next question, why don't you talk, there are folks who talk a little bit about, why is this different than the flu? And what should people generally know about COVID-19? And why are we reacting in such a way?
COVID is similar in the sense that it's transmissible in the same way. So people acquire this virus through respiratory droplets. When people who have COVID-19 sneezes or coughs, when they're infectious, can transmit it very easily to other individuals. What's different about this virus when you compare it to the seasonal flu is from the data that we already have from places like China, South Korea, is the fact that a greater percentage of people who acquire COVID-19 may get severe disease, whereas seasonal flu, less than 5% may have a serious illness. With COVID-19, in some percentages can be up to like 15 to 20%.
Yeah.
And also the mortality related to this virus is higher than seasonal flu. So there's a lot that we don't know, and information is constantly being updated. But while transmission is similar, some of the effects after someone gets it is different.
Thank you for that. Along that line of questioning, I know we have a question regarding testing. So we're going to, is it Jean? Just 1 second,
Yeah.
Jean. I'll go right at Jean. Why don't you ask your question regarding testing?
Yeah, I want to know when and where it will be available for us in Dutchess.
Okay, great question, and it's obviously on everyone's mind. Number one, there is little question that accessing testing across the country has been difficult, and there are a lot of reasons why that's unique in this country, whether it's FDA approval or simply accessing the kits. Accessing testing across America has been limited, and the rollout and advancement of testing access has been slow, and I'll say clunky, but challenging is probably a more official term. So first and foremost, private, and doctor, you can confirm, why don't you confirm for me, but private healthcare providers do have access to some testing. You want to talk a little bit about that? And what's the protocol?
That's correct. What I would say that, again, the vast majority of individuals, okay, with minimal to no symptoms or symptoms that would not warrant them to go to a doctor or the emergency room should probably not get tested.
So this is important, right? So just like another ailment, for instance, if you're not at risk or the symptoms are so limited, and I hate to use this, but another coronavirus, the common cold,
Correct.
You might not go to the doctor to be tested. You just would weather that. It's when the symptoms, now this is your, I'll let you correct me if I'm wrong, but when the symptoms advance or you feel as if there's some distress, really you want to have that conversation with your physician. Is that fair?
Absolutely.
Okay,
Absolutely.
and so even though there's challenges, physicians do have access to some testing capacity. Individual physicians do. The larger groups have larger access.
Correct.
And so that's number one. There are certain situations that might allow the Department of Health to perform tests, but that's still fairly limited. And to the broader question, so the New York State Department of Health has a request from Dutchess County, and they're working on an emergency. You want to mention?
Yes, sir, they are. We put in a request through the Department of Emergency Response to New York State Department of Health and Office of Emergency Management to establish a mobile testing site in Dutchess County. That is in process. It's a stand-up medical facility, so obviously it can't be done overnight, but we're hopeful that that will become operational soon.
So that's Commissioner Dana Smith from the Department of Emergency Response. I also want to mention that we are working with a private healthcare network in the expectation that they will prop up a mobile testing facility as early next week. We don't have that yet to announce, but those will become available. So we understand believe me, the frustration. This is not unique to Dutchess. Counties across the state of New York, and even the governor again said today, accessing testing is very, very challenging, and the number of kits, the number of access points, if you will, is limited. But we do want to say this: if you feel as if that you've contracted COVID, or you're dealing with symptoms that are just too much to bear, you should absolutely call your physician. Number one, talk through that the issue with the physician. They are given protocols to ask certain questions to help determine if you're likely to have contracted COVID. If it's a situation that's so distressful or you feel it's an emergency, you should dial 911.
Yes.
And so when you dial 911, our dispatchers have been given a series of questions to help screen and determine whether or not you may have contracted COVID. And then there are steps, obviously, for emergency responders to participate in helping. So we understand, believe me, we understand the frustration regarding testing access. We have a request through the New York State Department of Health for a location here in Dutchess, and we are working with a private provider that we hope will have testing operational early next week. So I know that answers probably half of the questions in the queue. If you have a question and you're on the call, please hit 0 on your phone. You'll be able to record your question or comment. If you have a question right here on Facebook, feel free to comment. There was one question that many people were asking about school closures and for how long. My wife would like fewer days with schools closed than more, but first, this is what you should expect. The 3 counties in this region made the decision with school districts, and we meet regularly with our school district superintendents, that schools should be closed for not less than 2 weeks. That would put us into the second week of April. The governor has made a similar assessment based on the trends and what we see both in other countries and now happening in New York. I think it would be fair to suggest that school closures will likely exceed the 2-week period. Now, I'm going to be a little more casual than maybe the governor or others might be. I do think that it is likely that school closures will exceed into the month through the month of April. Many school districts have spring break schedules and what have you. Now, there are still some protocols to be established by the State Department of Education, and obviously those decisions have not yet been made, but if I'm a mom or dad at home trying to plan for the longer term, it does seem logical that we will be weathering this particular emergency at least through the month of April. And while some may be concerned that could go longer, that's what I would at least prepare for. Anil, I don't know if you can help us with this, but a lot of people ask about flattening the curve. Can you talk a little bit about what that means and how and why this social distancing and slowing down transmission? What does that all have to do with trying to respond to COVID-19?
Okay, let's speak about the curve first. What we do is initially with any outbreaks, we look at a timeline and the number of cases we identify over time. And we plot that on a graph. And currently, what we're seeing is an exponential growth. And that will continue until we get to a point where a significant proportion of the population is infected, or we put in measures to make sure that slope is blunted. So some of the ways you could blunt that slope is to make sure that social interaction does not take place that gives opportunity for transmission to occur. So when you put these mitigation steps, such as social distancing and these closures, what you're doing is reducing the social opportunities for face-to-face contact and transmission. And therefore the numbers of cases drop and the overall curve is flattened.
And that's important not only for controlling the disease itself and obviously limiting the number of individuals who contract it, but also in managing the healthcare system.
Absolutely.
So-
If you do not blunt the curve, what you will expect to see is more individuals who are the most vulnerable coming down with illness, and they will stress the hospital and emergency systems. And we currently don't have capacity for that.
Okay. So you're on the call. This is County Executive Mark Molinaro. Of course, this is a telephone town hall regarding our response to COVID-19. You're on the line with 10,000 of your neighbors throughout Dutchess County, joined by Dr. Anil Wythian, the Commissioner of the Department of Behavioral and Community Health here in Dutchess County, Commissioner Dana Smith, who leads their Department of Emergency Response. We're going to go to Eileen, who had a question. Let Eileen pop up. Eileen, if you're there, you had a question, I think, regarding shopping.
Yes,
Go ahead.
this is Eileen. I would like to know, I'm 82 years old. The stores, the grocery stores have special hours for seniors shopping now. And I'm wondering whether I should go shopping tomorrow morning at between 6 and 7:30 a.m. or I should have food delivered. I have no outward symptoms of anything at this point.
So I will say I won't speak as a doctor, but I will offer to you that if you can have the delivery, do the delivery. It is terrific. We've been able to coordinate from Adams to Stop and Shop. I don't want to mention all of them. You'll find them at dutchessny.gov. A good number of businesses have agreed to open special hours for seniors. And I'll ask you, Doctor, in a moment to talk a little bit about why seniors should be concerned. So there are those hours. Now, the concept of those hours is basically to provide an opportunity where fewer people that would be vectors of the disease, transmitters of the disease, would be in a location at the same time. But that doesn't mean that that's entirely without its own risk, right? So certainly individuals could still contract the disease and transmit the disease, but knowing that those hours are set aside is safer. I would want to say it's a little more risk-free, right? But if you have the opportunity to have it delivered, you should. Now, I will tell you that still grocery stores have product, not everything we need, but some are still providing curbside pickup. Some of it's delayed. If there are businesses, community groups, and organizations who are providing delivery. Visit dutchessny.gov. You'll get additional information online. Additionally, there are individuals, even one of our county legislators, Greg Pulver, the chairman of the legislature, has volunteered in his area. And if the 24 other members of the county legislature are listening, maybe you want to volunteer in your area to be a source for delivery as well. So we would prefer, I think, and encourage delivery. It's best to stay in place. But why, for Eileen's point, why would a senior be of more concern? I think it's an easy answer, but go ahead.
Yeah, absolutely. When we look at the data that's coming from places like China and places like South Korea, what we're seeing is, if you look at the age breakup and the people who are getting very sick, hospitalized, and having a fatal outcome, the vast majority are over the age of 60 and 70. And so we would like individuals in that age group not to have the type of interaction that would put them at risk for acquiring disease.
I appreciate that, Doctor. And so I noticed, and I don't know if we're going to get to her, but there was a woman who asked about whether or not COVID-19 could cause permanent lung damage based on what we know, because it is basically a respiratory, it roots itself in the respiratory system. Go ahead.
So this particular virus has what we call in medical terms a tropism. It loves to go to the lower respiratory system. You know, many viruses can cause viral pneumonias, but this virus, what it can do is cause significant damage and injury to the lungs. So it's not out of the realm of possibilities of causing long-term scarring and damage.
Okay, so if someone is dealing with a respiratory illness already, they're obviously high risk.
High risk.
So it's best to stay in place and try not.
Absolutely.
Okay. So if you're on Facebook, we appreciate you adding some questions. We did get several questions from folks regarding daycare providers and childcare. And believe me, one of the most challenging aspects of the most recent decisions to close businesses and schools has been what to do about daycare. This is what I want to offer. First, the Dutchess County Department of Community and Family Services has worked with child care providers through the Dutchess Putnam Westchester Child Care Council to establish basic protocols. This is a real challenge. The state of New York has decided, and we have concurred, that forced closures of daycare will pose an enormous challenge for our ability to respond. And I know that this is not what many child care providers or moms or dads who are doing this at home want to hear. But the truth is, you're a part of our emergency response now. This isn't, this is different as an emergency. Now, we've put in orders for equipment and supplies that we hope that we can provide child care providers. But the truth of the matter is, if moms or dads who are nurses and doctors and physicians, if they're emergency responders or 911 dispatchers and don't have an alternative, the system closes down. And the ability to provide that help becomes so critically difficult. So what I want to offer is this: we recognize that challenge, and the guidances that we're offering are meant to maximize the social distancing that we've talked about, minimize the numbers within daycare providers. At the same time, I would offer this: if you're a mom or dad at home, and your children at home, as they likely are, and you can afford to give that space at a daycare provider to someone else, or simply have your child step out so that the provider can meet the social distancing expectations, we're going to ask you to do it. It's an act of selflessness if you're able to do that. I will tell you that one of my children is in daycare in Red Hook. They're like family to us. We decided that we're just going to make the space available. We're paying whether he's there or not. And if there's an emergency provider or someone who needs that space, they'll be giving it to him. Now, additionally, what you should know, Governor Cuomo in his emergency order asks school districts in the state of New York to do what schools in New York City have done. And it's not exactly the same structure, but what he's saying is schools within Dutchess County, for instance, if they can make their structures available, buildings available for childcare, and there are local providers who want to work in conjunction with that school to provide daycare in particular for emergency responders and healthcare providers, we're trying to assist in that. So we've actually had school districts ask us to connect them with childcare providers through the council in the hopes that we can prop up those services at a school with providers who are able and willing to provide that care. And in doing that, you'll see some of the private providers close some of their space. So it is a balance that is just, it's heart-wrenching in many ways, and it is I'll admit, it's one of the more difficult challenges and questions that we've been posed with, because we recognize that asking child care providers to be emergency responders and to obviously, be in the position of catching COVID or transmitting it, we understand that challenge. So I appreciate the question. We're trying to limit the impact, and we're going to continue to work with you to do that. So what I'd like to do is, if you have a question, press 0. There are a number of questions regarding the how many cases and where are they. So this is important. And it goes, by the way, to testing. As testing expands, we will all find out that more people have contracted COVID than we had thought. Now, mind you, I think we had thought that. But so when this first began, you remember the process was sort of, hey, we announced we have a case, and then we announced we have another case. I will offer to you that the direction from the CDC and the State Department of Health is not to identify the municipality or the residence of the individual. And I know that caused consternation. There are people who were a bit frustrated by that, and I can understand. But there's a few realities. One, I think, and you'd confirm this, I'm sure, that we knew from day one that the number of identified cases is not a reflection of the number of people who have. Yeah, go ahead. Yeah.
It's only the tip of the iceberg. So the cases that are identified are the clinically significant cases that come to our attention. But there is a whole undercurrent of cases that will never get identified because they're not tested,
Sure.
or they don't go for testing.
Right. So identifying, though, a case in Yonkers, New York, which is a city of nearly 1 million people, versus a single case in Tivoli, New York, is different. And from a physician's perspective, why is that different?
There may be situations where if we identify a case, we would like those contacts of that case to be notified and take proper precautions. And in situations where there's no other way except to notify individuals the location, we may do that. But usually we don't need to do that.
And so in our situation, what we made clear, and by the way, this wasn't exactly the protocol, but we followed the guidance from CDC and the New York State Department of Health out of respect for the patients themselves. There are concerns about personal privacy, and I understand somebody says to me, well, telling me that one person in Amenia has contracted COVID is not a violation of their rights. Well, it is if you can figure it out, and I don't mean to be casual about that, but we want to respect that. The other is, folks, we are functioning, and you should function under the assumption that you or your neighbor has come into contact with somebody who's contracted COVID. And so as testing becomes more and more available, we're going to go from 28 identified cases to 200, to 400, and whatever that number is. And you've seen that on the television screens. It's not that these are just magically new people who have been identified or have contracted COVID. It's that these are people who contracted COVID that we finally have tested and now we've identified, and that's going to continue. And so from that perspective, those were the decisions we were making. And we've gotten to a point in New York, and certainly in this region, where there are so many that have been finally tested and identified. It is immaterial to know what municipality they're in. It's just we all need to function as if we need this to minimize transmission and allow this to work its way through our society and protect and respond to those who are most sick. And that's a fair response.
Agreed.
So if you have a question, hit 0 on your phone. If you're online, feel free to type some comments and questions. This is County Executive Mark Molinaro. You're on a telephone town hall. We're going to do this again in 2 weeks on April the 2nd. We'll be having an additional conversation, another live telephone town hall. I will tell you, April 2nd is also International Autism Awareness Day. So one of the things I'd like to do when we get back together in 2 weeks is talk a little bit about what families with young people on the spectrum and young people with disabilities might be confronting as they're all home. We'll ask some people to give us some guidance there. But what I'd like to do is go to, I think, Dan. Dan is on the line with a question regarding the sun and warmth. Dan, go ahead. Dan, are you there?
Yes, I am.
Oh, Dan, your question was in relation to the concept of what happens as spring comes on, I think, but go ahead.
Yes, I was told that when it gets warm that this virus they're expecting to get lower and kill it. Is there any truth behind warm weather?
Yeah, it's a good question. I'll let Dr. Wythian answer that. I will tell you that keep in mind what we've seen across the globe as far as numbers and the reaction and the growth of COVID-19 has occurred during cold months. So this data and the statistics as that that we have to date are in countries that were living through wintertime. What does it mean that when spring comes, Doctor?
Sure. People are making sort of a connection between what we see with flu, because flu we typically see from November to usually peaks in February. But what we know about human coronavirus is they affect humans throughout the year. And if we can make an extrapolation from MERS, which is was a coronavirus that was in the Middle East, transmission occurred readily in temperatures that were probably over 100 degrees. So I don't believe an increase in temperatures is going to be the rate limiter in terms of transmission of this virus.
And that's important, and there's more about this virus that we don't know than we do know, and so having obviously telling people to try to minimize transmission regardless of the time of year, which is one of the reasons the social interaction and social distancing is important. While I have you again, this is County Executive Mark Molinaro. Thank you for being on the call. We'll continue for a while longer. I want you to know that there are over 800 people on Facebook following. And 10,000 of your friends and neighbors on this call. We're going to do this again in 2 weeks on April the 2nd. We'll give you another update at that point live through Telephone Town Hall and Facebook Live. If you have questions that you'd like to ask, hit 0 on your phone. You'll be asked to record that question so we can get you into the queue. Also, I just want to mention to you, visit duchessny.gov. At duchessny.gov, you'll find some information, obviously, about COVID and our response to it. Some opportunities over the course of the next few days. You'll see on the website populated some opportunities to sign up to volunteer, to contribute funds, to purchase foods and goods for those who are most in need. Also, some additional information if you're a small business owner or an individual proprietor that has some services have been made available to us through the Small Business Administration. And you can get that information at duchessny.gov. Again, if you want to volunteer, duchessny.gov/MRC is your opportunity to join the Medical Reserve Corps. You don't have to be a physician or a medical background to do it. MRC is our group. duchessny.gov/MRC will give you the opportunity to volunteer. And there were a couple questions regarding the phone number, so let me give you that one again. 845-486-3555 is our hotline. 845-486-3555 is our hotline. Let me also, while we're pulling up the next question, we'll pull up the next question. We're going to find one. Why don't we let's talk about certain. We'll go to Patrice in 1 second. Patrice, get ready. We're going to pull you up in 1 second. I just want to say this. We've talked to so many groups over the last couple of weeks. This isn't like a snowstorm or a fire. This is an emergency that we can't really see. And I know that you'll watch the television and read on social media. Certainly, some people will say, it's a hoax, or it's not so bad. Listen, I am all for not overreacting. I'm all for trying to tone down the hype and the panic and focus on real information, because I think if we overplay it as we've seen, and certainly in the media, a little bit too much bombardment. Good, solid information is important. But if it's too much, people turn it off and they don't want to listen to it. So as important as it is not to overreact, it is equally important not to underreact. And what that means is to take the steps that we all know are necessary to protect ourselves. That means this social distancing concept, at least while we know the virus is going through our community, you want to minimize transmission. My mother really wants to come to my house and hang out with my kids. I would love my mother to come hang out with my kids. In fact, I'd love my mother to hang out with my kids and my wife and I not for an hour. But the truth is that that's social interaction. Even going to church, even hanging out at a restaurant or bar, it is that interaction, if you have the disease, that will allow for transmission. So taking those steps, washing your hands. I'm going to ask Dr. Wything to explain the difference between antibacterial soap and regular old soap and why that's important in a minute. Washing your hands, keeping that social distance, all very important. When we encourage social distancing, we're not encouraging emotional distancing. We're blessed with so many wonderful tools, Facebook, Twitter, social media, FaceTime. You could call somebody through Alexa or your Google apps, whatever it is that you have. You can stay in contact with people, and if anything, I think that this should be one chance, the one silver lining, that we use those tools to draw a little bit closer together. So I know the anxiety many people feel and the tension many people have. Just know you've got a great team of professionals who are responding. They've been working 24/7 for 4 weeks now. We have wonderful volunteers all across Dutchess County who are responding. We have great community organizations, all part of our efforts to be helpful. And again, Dutchess Responds is sort of the hashtag that you'll find a collection of those activities. Church leaders, synagogue leaders, faith leaders, mosques, all across this community who are working hard to help us rise to this occasion, and I'm confident we can. So we're going to go to Patrice. Chris, if you want to hit Patrice, not hit Patrice, if you can bring Patrice up on the call. She had a question. Really have to be careful. Patrice, go ahead.
Hi, this is Patrice from Arlington. We've been running into a problem during the last week. We have gone from certain stores, from Walmart to Sam's to the local corner deli, and a lot of stores are short of things, some essential like tissue, and they say they're out because people have just come and wiped them out in bulk, and they have no idea when a lot of these things will be replenished.
So,
I mean, not just, there's medicine, there's even just acetaminophen, anything, they're all gone.
well, one, you've brought up certainly a challenge that we're all going to have. Now, the emergency orders that have been made exclude the distribution of goods. So at the very least, if those supplies exist, grocery stores and retailers and others, truck drivers, again, it's a different kind of response. We're used to, Commissioner Dana Smith from Emergency Response is here with us, we're used to firefighters and ambulance drivers going out, and certainly they have an important role in this response. But now so do truck drivers, and so do some daycare providers. So the distribution is still occurring. I know that our grocery stores are having a difficulty accessing certain items. I think it's useful when you get to a store, if it's your store, if you're a local sort of grocery mart or what have you, I think it's critical that you say to them, when do you think the next order is going to come through? And try to organize around that, and certainly take advantage of those special hours for seniors. If you are a senior, I'm not suggesting, Patrice, you are, but if you're listening and a senior, take advantage of those opportunities, because those might be times where access to certain products might be a little bit easier. That said, again, if you run into a serious need, we hope, certainly by the end of the week, if you visit duchessny.gov, we're not able to find those products necessarily, but if you're in crisis, there are organizations throughout Dutchess who are attempting to assist. Dutchess Responds is our network, and there are organizations that can be helpful to you. We continue to work with the governor. You might in fact see from time to time National Guardsmen and women in uniform, even some military vehicles. They're likely around Dutchess County delivering product. It could be masks, personal emergency equipment, perhaps water, and I saw even some with even paper towels and hand sanitizers. So those are all efforts that are underway across this country and very aggressively here in New York to move product. But we're thankful to those businesses who have opened those special hours, from Adams, our local folks, to the large retailers like Stop and Shop and ShopRite, all making available those opportunities. We're creating through Dutchess Responds a network of folks who will also make purchases for you. So you might make that order online, and an individual might be able to deliver for you. Again, that'll be you'll be able to access that information at duchessny.gov later this week. So one of the questions that I think a lot of people have is sort of how serious is this, or how easy is this to transmit? And so Jackie on Facebook asked, if I have mild symptoms, do I go to work? I think the answer is no.
No.
But go ahead. And what are the symptoms that they should look for?
So we knew from the very beginning that, again, individuals with serious symptoms can experience fever, cough, shortness of breath. But with all viral illnesses, there are subclinical symptoms where all that people experience is malaise. They can have ache and just basic mild flu-like illness. And what we know about this virus is it's very infectious, and it's infectious early. When you compare it to SARS and MERS, by the time people were at the peak of infectivity, they were very sick, and they were in a controlled setting where people had put in place control measures so that they couldn't continue to spread. This virus, you can spread it with very minimal symptoms.
And one of the questions from Laura on Facebook was, do you have to have a fever? So why don't you... Yeah, go ahead.
Not at all. Viral illness, depending on how old you are, your immune system, and what your genetic makeup is, can present in different ways. Severe illness can present with fevers, but a lot of viral illnesses can be just very minimal, if at all, any symptoms.
And so we've talked a lot about the impact on what we would argue are, I apologize if I could, I know there was hand sanitizer around. We've talked a lot about high-risk populations like seniors. There's some questions about young people, very young people, like infants. What do we know about COVID and its impact on young kids?
The good news is that individuals who are young, they tend to have very minimal, if mild symptoms, and the likelihood that they will have severe symptomatology is very slim. But there have been case reports of individuals who are young and had severe illness. And that may be related to a genetic predisposition or some immunological issue. But for the most part, if you are young and healthy, the likelihood that you will have severe illness related to COVID is very, very slim.
Sure. So we're going to go to Mary, who has a call. If you have a question, hit 0. We'll get you into the queue. Mary, you had a question regarding businesses? Are you with us, Mary?
Yeah.
Go ahead, Mary.
Yes, hi.
Hi.
Yes, I'm on unemployment and a seat program right now. It's running out in about 15 weeks or so. And trying to develop a new business that there probably won't be any buyers for. And what's the chances of the federal government and the state government extending unemployment benefits, number one? Are you eligible for them, number two, if you were already in the program when this happened?
What I want to say first, if you have, and I want to answer your question, but if you have specific questions regarding benefits that you're receiving or that if you're listening you'd like more detail about, again, visit duchessny.gov. There's a contact there. You can push that button. We'll hook you up with our business network and ensure that we get you more specific information. We have a team led by Assistant County Executive Ron Hicks, focused purely on the economics of this impact. Most of the economic impact is much larger than any local government can address. So we are working in coordination with the state and federal government. Let me answer your question, which is what's the likelihood of those benefits being extended? And I think the answer, while the state government hasn't acted on that yet, it is likely they will be extended. If you've been listening to the news over the last 2 days, the national government does seem like there will be creating new financial assistance to individuals and to businesses that will roll out over the next few days. Some things that may be even protecting the loss, economic losses, payroll, if you will, losses of businesses of a certain size. And individuals. So it is likely those benefits extended. New York has waived some of the waiting period for benefits if you've not already accessed them. If you're on them, it is likely that they will be extended, and that is, I think, important news. And if you're a small business, currently, Dutchess is one of only 3 counties in the state that have been approved for federal Small Business Administration loans. And some of you may be out there thinking, well, I don't want a loan. I've lost all this money. Here's the issue at the moment. If you qualify for the loan, it may be better for you to pay small or incremental payments over a longer period of time until this passes and perhaps you can reestablish the business or rebound than it is to have to find the money right now and pay all of it. We have requested of the state of New York a waiver, a delay in payments on sales tax. There's some business owners, we'll be talking later in the week. Dutchess County has an adopted sales tax, but we don't actually collect the sales tax. The state of New York does, and we've requested that they give businesses more time, an outright delay, so that you don't have to make the decision to make that payment. Now, not paying sales tax will actually be a revenue loss for the county while we're using it to fund, but we think that at the very least there ought to be a delay so that small businesses don't have that impact. And we'll be talking to small business owners in a similar call later this week. On Friday, we'll be talking with them. So we had some specific questions from Facebook. One is the DMV closed and can I renew my license? And a question regarding county offices staying open. First, let me tell you that we had already begun the process of trying to have more and more of county government function online or remotely. So offices that didn't have a public face were asked to scale back their in-office use. But Dutchess County government intends to remain open. We not only have to be open to respond, but to the extent we can provide core services to residents safely, we want to do that. So the DMV remains open. It's led by County Clerk Brad Kendall. It is open. We have one DMV office in Pauling that the clerk decided to close, and they expanded capacity in Millbrook. So what we are asking, and actually these days I think you'd find, certainly as folks make use of the DMV, we're asking to exercise precautions, social distancing, try not to wait in lines, and staff will encourage you to do that. You'll also notice there'll be fewer faces in those offices. So staff is downsized on the front line a little bit, more people working from home. In fact, the governor requested that government and public employers scale back the number of people going to offices by 50%. We've been able to achieve that and more. Private sector today was asked to reduce to 50% staff who are in businesses. So you'll see a few less faces working, so be patient with them. And certain services are curtailed at the DMVs. I'm pretty sure you can renew your license still, but they're not doing permits. I had a 16-year-old get very upset at me that they're not doing permits, but please understand, this is one, we trust a momentary disruption in our lives that will have major impact for the long haul. So we need to be very serious about the impact on businesses and others. But there's certain services that will be scaled back at DMV, and you can visit duchessny.gov. And that information will be there for you. So Lisa, we're going to go to another call. We're going to Paul about this is a good question about quarantine. Paul, in 1 second, if you're there, why don't you go ahead, Paul?
Yeah, I wanted to ask, if I tested negative for COVID-19, would I still need to quarantine for the 14-day period?
Okay, that depends on the type of exposure that warranted testing. What the testing tells you is at that point in time that you were tested, that they did not detect this virus in your system. But that does not tell us whether a few days down the line after the test, or even maybe a week after you've been tested, that you will not develop symptoms. This is why the current guidance exists that individuals, if they have had an exposure, should be self-quarantined or mandatory quarantine, depending on the level of exposure, so that they are in a controlled setting if they develop symptoms of the disease.
We had a Facebook question. If you're watching on Facebook, please feel free to comment a question regarding young people sort of thinking they're immune to this and not wanting to engage in social distancing. In fact, if you watch on television, there are folks on the beach in Miami saying, what the heck. You want to? Why don't you give a doctor's warning to those teenage patients and others who don't necessarily believe that this is going to affect them in any particular way?
So they may be lulled into a false sense of security because, again, that is not the population that typically is being tested at this point. And what they may be doing is engaging in activity which may promote the spread, but ultimately they may be going back to families that may include a grandmother or a father or a parent that may have underlying medical conditions. So they should really think about whether they are taking all the steps that they can, not only to keep themselves healthy, but their families too.
Thank you. And I think it's an important reminder. We call them vectors, right? A young person could contract it and simply transmit it to someone who is higher risk. And as Dana Smith from Emergency Response, you watched a little bit of what happened in Italy.
Exactly. Because of the generational living that's commonplace in Italy, that's why their numbers increase so rapidly and has such a high number of deaths, because we have great-grandparents, grandparents, parents, and young children or teenagers living together, and it dramatically increased their numbers almost overnight in some cases.
Thanks for that. So we're going to go to Amy. Amy's on the line. In 1 second, we'll activate your call. Amy, I think you had a question regarding hospitals. Go ahead, Amy. Are you with us, Amy? There you are. Go ahead, Amy.
I am.
You are.
Hi, I guess I am.
Yeah, you are.
Oh, okay. Yeah, it was just a question whether there was one place better than another, a hospital or facility that was better than another to go if you do think that you have contracted the virus.
Okay, thank you.
Whether it was at the hospital or someplace else.
Thank you for that. And online, Brian asked us a little bit about hospital readiness. I think you both, let's talk generically about hospital readiness, but I'm going to answer Amy's specific question. The good news is the hospitals you have locally are all able to treat you if necessary. Now, we do want to talk a little bit about when you should or shouldn't go to the hospital. Mostly you shouldn't first. Maybe talk about those protocols, but also talk about what we do in emergency planning for hospital capacity. But I will say this, listen, if you live in Eastern Dutchess, getting off to the Sharon, Connecticut Hospital is as good as living where I do, heading off to Northern Dutchess. But there are protocols. Let's start with, do I just go to the hospital?
Now, what we would prefer, unless it's a life-threatening emergency, we would prefer you start with your primary care physician if you have one. If it is a life-threatening emergency, we encourage you then, if you're having difficulty breathing or some other associated symptoms, call 911. If that's not the case and you decide you want to go to an urgent care center, a standalone facility such as that, or a hospital's emergency department, we ask that you call ahead and advise them of what the symptoms are and what your complaint is, and the staff at the hospital will be able to triage that and be prepared for your entrance. They may offer specific instructions on where to go when you do get to the hospital. So if you are positive for COVID, you do not have an impact on the rest of the facility or other patients who may be waiting for other reasons.
So what have we been doing with hospitals to evaluate capacity, and what do hospitals, and what planning is in place, either of you? I'm certainly asking questions I know the answer to, but what does a hospital do in case of this surge, this wave of new patients?
All hospitals should be planning, and they have been planning for decades. What they always plan for is in terms of how do they meet the need, or how do they ramp up capacity when the situation dictates. But again, there's just so much that hospitals can do. They may be able to increase the number of ventilators at a given time. They may be able to sort of like elective surgeries and elective procedures, they could sort of postpone so they could increase capacity in that way. But the number one way that hospitals are able to sort of deal with the situation is if they are not bombarded with the worried well or the minimally sick.
So you used a term that many people don't use often, which is the worried well. When some people hear that, they think there's a well and there's water. No, but the worried well means.
Yeah. So what has to be stressed is even with this virus, 80% of the individuals who contract the disease have minimal or mild symptoms that would not warrant things like respiratory support or other hospital-based treatment. If that is the case, then these individuals should not be going to the emergency room, should not be going to the EDs or urgent care centers and basically burdening the system. The system needs that capacity to deal with that 20% who may have more severe disease.
Sure. So the governor and the president both talked about hospitals deciding to limit elective surgeries. Our hospitals have made certain limitations. Do you want to talk a little bit about the demand that hospitals have and what the capacity is as it relates to those elective surgeries?
Yeah, we have to realize as well, day to day, besides COVID, there's regular medical emergencies and trauma emergencies that will continue to occur. Everything associated with COVID is on top of what occurs day to day, so we have to factor that in. By minimizing elective surgeries, hospitals have the ability to open up 20 to 30% of their beds, at least for a temporary basis. Then additionally, hospitals all across the United States have a position that they didn't have 15, 20 years ago as an emergency manager. And every hospital in our region has staff that are dedicated to preparedness and response, and all these plans, they partner with their local community, the other hospitals in the county Department of Health, of Behavior and Community Health, emergency response, our partners at the state, regional, and federal level. So there are a lot of planning efforts and educational efforts in place, and contingency plans that are developed to address issues just like this.
So on the line is Jeff. Jeff had a question regarding safety masks, medical masks. Jeff, do you want to ask that question?
Yeah, what is the protocol? When do I get one? Where do I get one? What should I get? What type of mask? I know I've got some masks downstairs I use when I'm sanding drywall.
It all depends on what.
Thank you, Jeff.
Sorry.
Dana's new at this. We appreciate that question. I'm going to let Commissioner Dana Smith start by answering as Commissioner of the Department of Emergency Response. This is, I think, at least the $5,000 question, if not the $500,000 question many people ask.
Absolutely. Everybody hears the term N95, and N95 is a high-efficiency particulate mask that's designed to protect healthcare professionals and emergency responders who have to make direct contact with patients that could be infected with COVID. For the average person who's going about their day and maintaining social distancing, no mask whatsoever is required. If you follow the social distancing and minimize your exposure to others, no mask is required. For healthcare professionals and emergency responders who are directly dealing with sick patients, that's when those type of masks are involved. Doctor, would you like to add to that?
I would also add that, again, sometimes masks give us a false sense of security. Because, again, if we know how this virus enters the body, if you're wearing a mask and rubbing your eyes and touching your nose and touching your mouth, you're still introducing the virus into portals of entry.
And additionally, one last point, you hear about the famous N95 mask, which is in very short supply. They have to be specifically fitted to each user by manufacturer, model, and size. So if you buy one that isn't properly fitted, and that's a process, it offers little to no extra protection.
So that actually leads us to one of our Facebook questions, and I know, Dana, you'll enjoy answering this. What are we doing to protect first responders?
Okay.
Go ahead.
Well, first off, protecting for droplet transmission is something that's been a rule for all healthcare and emergency responders since the early 90s. There's actually an OSHA standard and the New York State APESH standard. So they do have supplies. Do they have enough based on the risk today? No, they don't. So the Department of Emergency Response has been working closely with healthcare facilities, nursing homes, colleges, schools, and first responders to get orders from them and submit those orders up through the state system and ultimately to the federal system by the President releasing assets from the federal stockpile that'll support all states. I will admit it's frustrating. It's not as quick as ordering from like an online service, but we are pushing every day. County Executive Molinaro is personally communicating with the governor's office to do everything we can to make this as efficient as possible.
And I think it's probably good to reinforce that while there are these frustrations, and by the way, there are these frustrations with every emergency that we respond to, this is a bit broader because it is global, and the needs exceed even the capacity of a single state, although our state has a lot of assets. But the communication has been tremendous. I do want to offer, if you see your town supervisor or village or city mayor, I'm not saying you should thank them, but you could thank them. They're on the front lines with us. So we're communicating every day with supervisors and mayors, and they're working to secure locations for food distribution. The town of Wappinger wants to actually expand its community garden so that there might be food. These are all the things that among many other things, emergency purchases, uses of signage equipment. Many supervisors, I know Red Hook, Rhinebeck, and some in Southern Dutchess are organizing businesses to make available food. The town of East Fishkill has launched its own sort of communication structure and many are doing this. So without highlighting one above another, all 20 towns, 8 villages, and 2 cities, we are speaking nearly daily about what are the protocols, what's the change in status, and how do we respond collectively. We are having the same conversations with New York State, and you'll kind of chuckle. The relationship we have and the conversations and the communication we have with the governor's office is seamless. Now, there are hiccups in the distribution of equipment and finally the establishment of testing, which I know many of you are asking about. We need these things to happen quicker, but we're all pulling in the same direction, and that's important in order to respond. So we're going to go to I think Laura. Laura had a question about heading out to the pharmacy, which I think is actually a good question as it relates to just going out to stores overall. But Laura, go ahead. Laura, you're with us. Laura, yeah, I apologize. Laura, you were going to ask a question about going to a pharmacy.
Yeah, how safe are you going into a pharmacy if you're over the age of 65 and you have to pick up your meds and there's somebody else there with maybe an underlying sickness you don't know about? So how safe are we? What should we do?
That's a great question. I'm going to let Dr. Anil Waidyan, he's the Commissioner of the Department of Behavioral and Community Health, answer that question. I'm not a doctor, and I did not sleep at a Holiday Inn Express last night.
You know, some of the things that we could do is to make use of the delivery services that a lot of pharmacies have. The other thing is to coordinate with your family. You know, sometimes a family member can go in your place to pick up. I pick up medicines for my wife all the time. So, I mean, these are some of the things you could do. But again, we have to stress that, again, this idea of social distancing includes, you know, deciding when it's actually reasonable for you to go out to places such as pharmacies. And, you know, we need to stress that even if you have to go out there, social distancing, hand hygiene, and the respiratory hygiene, those are the things we must continue to do daily.
Terrific. We're going to open up a question from Nate regarding animal transmission. Before we go to Nate, though, it's a good opportunity to remind folks to visit duchessny.gov, duchessny.gov. There will be some additional information under the heading Duchess Responds, where we're working on establishing, and we're very close to establishing, a network of volunteers and others who will provide distribution of food to area pantries that you'll be able to access in partnership with a number of providers, but also individuals who will actually do the shopping for you. So we'll be assigning volunteers throughout the county, and there are organizations who are lining up volunteers. So if you don't have somebody to get to the pharmacy, and you don't want to necessarily go, or maybe there's not a drive-through window, there will be an opportunity to connect with volunteers so that ultimately they can do some distribution for you. But I think we have Nate on the phone. Nate had a question about animal transmission of the disease. Nate?
Hi, how are you?
I'm great. How are you?
Not bad, not bad. Yeah, just wondering, can it be transferred to animals?
Thank you for that question. This is actually something, because people get concerned, not only can it be transmitted to an animal, but can an animal necessarily transmit it to you?
The short answer is yes. The long answer is there are human coronaviruses, but there are also quite a number of animal coronavirus. And this actually is an animal coronavirus that jumped to the human population. The same as SARS, the same as MERS. And so, in short, yes, it can go back and forth.
Thank you. We're going to go to Maureen as that question comes up. Maureen, I think, had a question in regard to it's getting warmer, and you know, is it okay to be outside and the issues of social distancing? But Maureen, go ahead. Maureen, are you there? We may have to, Maureen, I'll give you one more. Oh, go ahead. Yes, Maureen, go ahead.
Yes, hi. I was talking about being outside, walking the neighborhood, the rail trail. There's a lot of people out because they're tired of being stuck inside. Do you still have the social distance when you're outside?
And that's a good question. First, I want to tell you that, of course, our parks will remain open. We want people to use them with some degree of awareness, but why don't you talk, Dr. Waidyan, who's Commissioner of the Department of Behavioral and Community Health, a little bit about, you know, do I social distance even though I don't have a roof or walls around me?
Absolutely. You know, I will tell you that during my lunch break, I went out and walked on the rail trail. So I think it's not realistic to think that people can stay indoors for basically the whole time that we're asked to sort of like social distance. But even when you go outside, it's reasonable to maintain distance and not really have that face-to-face interaction that will be an opportunity for the virus to spread.
So we want people, you want to answer that, Dana?
No,
Commissioner Dana Smith from the Department of Emergency Response.
state parks are open, or right here in Dutchess County in Poughkeepsie, the walkway over the Hudson sent out information, and the same thing with the county parks, high traffic areas where there is a potential for cross-contamination are being cleaned. They're paying extra special attention to those. But certainly as the weather warms and the weather gets a little bit better, it'll be a great opportunity to get out of the house.
Correct.
But just maintain that social distancing as asked for.
I appreciate that. We're going to, there's a question regarding evictions and utility. I want to get to that in a second, so we'll pull that one up. But we had a few questions come up on Facebook that I want to make sure we answer. Number one, questions regarding public transit. And really all government offices. What you should know is immediately upon the onset of our first case in Dutchess, we had initiated our what we refer to as extreme cleaning process. So we knew that this was something that was going to have to be enacted. And so whether it's the county buses, you'll see those continue to run, or any one of the county public spaces, bathrooms, what have you, in the county government building, if it's open, it's being cleaned at a much higher level. Although I begin, we should probably clean at this level as often as we can, but it's being disinfected in order to make sure that our facilities are as clean as possible. And I'm going to ask you, Doctor, to talk about the transmission on flat surfaces in 1 second. So public transit will remain operational for the time being. We think that it's a need, and certainly there are those who need to get to and from locations, mostly in some of our emergency and professional health care folks and others. There are county offices that will remain open, and again, we'll be practicing the social distancing and limiting certain services. There was a why don't you talk a little bit about the issue of transmitting on flat surfaces, and what are the guidances as it relates to
Sure. Depending on what the virus is, they have a capability of surviving outside the host. And so if you're looking at the flu vaccine, the flu virus, it could stay hours on solid surfaces. This virus, a lot of what we know about this virus is an amalgam of what we know about all coronaviruses and the SARS and MERS. And so the current guidance is that expect this virus to be still viable on surfaces for roughly between 2 to 9 days. And this is sort of a conservative estimate. It's probably a lot lower, but again, in places where high traffic areas where individuals with COVID-19 may be circulating, it's very important that we clean and disinfect those surfaces where other individuals who may not have the virus may come into contact with.
So we're going to pull up a question from Joseph. As we do that, you're on the line with County Executive Mark Molinaro. Nearly 12,000 of your neighbors are on this phone call. Certainly it's an important conversation. We want to encourage you to visit dutchessny.gov for additional information. Of course, our coronavirus information hotline is also at 845-486-3555, 845-486-3555. There are professionals within county government who are responding. I want you to know that we're organizing Dutchess Responds, an effort to both collect funds and to organize response and services, food to be delivered to pantries and locations throughout the county. Volunteers can sign up to participate in an effort to deliver products, food, services. We're also opening later this week a 24/7 facility in the city of Poughkeepsie for those that are displaced, homeless, and otherwise that might need access to services. We've issued an order to have that occur. But on the line is Joseph, right? Joseph, you had a question? You had a question regarding symptoms, I think. Joseph, if you're there, you had a question regarding when symptoms might be visible. So while we'll click off to another question, but Dr. Wything, talk a little bit about what's the likelihood, what's the time frame between maybe when I contracted and when I might start seeing symptoms. Do I have to see symptoms at all?
Sure. When someone's exposed, we know that, again, the vast majority of people, especially for this virus, if they're going to develop the disease, become symptomatic within roughly 5 days. The guidance is that we watch people and observe and isolate individuals who had exposures to 14 days. If they get to the second week or more after the exposure, the likelihood that they're going to develop the disease is very low. But nonetheless, the current guidance is we follow an individual, we place that individual on home isolation or quarantine for 14 days. But the vast majority of people develop symptoms within 5 to 7 days.
So we're going to go to John from Hyde Park. John, I think you had a question just about perhaps, I think, going shopping for a spouse or some of that, something along those lines. John? I can hear you. John from Hyde Park?
Oh, hi.
Well, you don't sound like John, but go ahead.
I'm the better half.
I have no doubt. Go ahead.
Actually, my question pretty much was answered. My husband is at high risk, and he developed a respiratory infection, and we were at the pulmonologist yesterday. And the pulmonologist took one look at the two of us, and he said, both of you should be home. And luckily, my husband is getting better. It's just a bacterial infection. However, he told me that I should not be going to the grocery store to shop. And again, I did call Stop and Shop here in Hyde Park, and I asked about the senior hours, and they were very nice and accommodating. However, she told me there is very little meat and there is very little bread. I was wondering if there's anything going to be done in the sense that someone will put only 2 per, not these people that are going and just literally cleaning the shelves off of food. Is there anything that can be done that way?
To limit the overall, in essence, hoarding of items?
Yes, sir. Yes, sir.
So I appreciate that question. So 2 things. The New York State Attorney General's office has established a hotline. We'll make sure that contact exists at duchessny.gov. The New York Attorney General's hotline. That is to both report gouging, if you identify price gouging, and you can also report items, individuals who are hoarding. But I will tell you that most businesses have established limits on some of the more critical items, and that ought to be honored. And I'd offer, to the extent that it's appropriate, law enforcement is prepared to enforce that. So if there are individuals who are hoarding, some are hoarding and then trying to resell, it's just not appropriate. Listen, we're going to weather this. We are going to weather this. This might take a few weeks, it might take a few months, but we'll transition into what is our sort of new normal for a period of time. People should be very sensitive to not hoard items because there are those who in severe need will need access, and to businesses. And of course, there are really at this point only retailers and certain service providers that are open. But price gouging is inappropriate. We were aware of a business I'll mention to you in Southern Dutchess that was gouging on, I think, cans of Lysol or something. And we made clear through appropriate enforcement that that's just not appropriate. So you can get that information at duchessny.gov. Later in this week, there'll be a link to the New York State Attorney General's office, so you can have that. As we were talking, Doctor, you started a firestorm on Facebook.
Yes, I did.
And that's the way it goes. Clarify about the issue. Can a dog or cat transmit to you, or through you, through them?
So the clarification is that coronaviruses have human and animal reservoirs, and so sometimes you could have that species jump. But our current understanding is you're not going to give this to your pets, and you're not going to make your pets sick.
Okay, I think that's important. Now, also, I guess I know you answered it a little bit before. The question of I don't know, if I sneeze on my dog, how long till those respiratory droplets could that sort of thing? Can I transmit to someone else, and they're watching you? So give the right answer.
So there are a lot of variables because again, when viruses and droplets dry out, they desiccate. They're less infectious. We know that. So it all depends on multiple factors. I think when you sneeze, the current guidance is that on solid surfaces, it could be on that surface from 2 to 9 days. For living things, again, I don't want to venture to make a guess because I don't know that information.
Okay, that's the right answer. We're going to, I think, go to John from Beacon, who, and by the way, so we're going to go to John from Beacon in 1 second. There is no Dr. Facebook. There may be so Facebook and social media is a very helpful tool to communicate with one another. Many times you'll see on social media the secret to killing coronavirus. Drink lots of something and it will go away. John, you had a question regarding drinking water and some other things. Go ahead.
Yeah. Hi, I'm Kathy. I guess you picked up the name John because it was on the
I did.
ID.
I must have.
My name is Kathy from Beacon.
Go ahead, Kathy
My
from Beacon.
question was regarding drinking and keeping your mouth moist so that if you were to contract the coronavirus, it could possibly get washed out through the stomach rather than keeping your mouth dry and having it get into your lungs. Is that true?
Dr. Y, who is an infectious disease doctor, is going to do his very best to answer that question.
I don't believe there's a lot of information on that, so I can't speak with great depth. But what I will tell you with any respiratory pathogen, one of the mechanisms that people get that pathogen into the deep lungs is they tend to aspirate it, especially when they're sleeping. So again, if they're not harboring the pathogen in the upper airway, the likelihood that they're going to aspirate it at night, and the aspiration may not be large amounts, it could be micro aspirations, little amounts. So there is a possibility, but again, I really can't tell you whether drinking fluids is going to decrease your chances of getting coronavirus or COVID-19 if you're exposed.
Okay, good to know. So we're going to go to another question on the, we had a call regarding the stages, I guess, of symptoms. I think from Pauling. Joe from Pauling had a question regarding when symptoms may appear. Joe, did you have that question?
Yes, I did.
Okay, go ahead. Ask the question. Feel free.
Well, it's about timelines of the different stages of the virus and actually how long before the full recovery if you do develop the virus.
Typically, if it's mild symptoms, individuals who are exposed will become symptomatic within 5 to 7 days. Usually, once you become symptomatic, recovery, what we typically see, is within 14 days. That is why individuals from the onset of symptoms, and if their symptoms are resolved by 14 days, we no longer have them on isolation, and they can sort of continue their daily activities.
Terrific. Thank you. So there were a few questions on Facebook regarding sort of preparing for potential shelter in place or quarantine in our homes. It's unlikely that we see anything as dramatic as Italy, for instance. But there has been talk, and certainly there are cities in this country who have already ordered shelter in place, I think San Francisco being one of them. That is a decision that would be made by the governor, or in the case of the city of New York, the mayor of New York. The mayor has talked a little bit about that. The governor has said he does not envision something like that. So I think this gets back to the flattening the curve conversation. As testing access increases, we'll get a clearer understanding of the total number of people who are carrying infected, living with COVID-19. And then over a period of time, in theory, right, we'd be able to monitor whether or not the actions taken are driving down the numbers. And I feel like I read today that Italy, for the first time in this cycle, has seen actually it's peaked and not, I think, plateaued for 2 days. It's the first time in the cycle that we've seen a flattening.
We call it the inflection point.
Is that what it is?
Yeah.
Okay. So based on their actions, they've seen this inflection point. The question for us is, all of these steps that we've taken, will that slow the growth? And if it does, well, then maybe they stay the course with the current, the current government actions. There's always the potential that government might decide to limit even more access. Right now, retailers are still open with limited staffing. The governor's asking essential businesses to remain open, but not essential to reduce their staff. So hopefully this social distancing and the limitation of this public activity will slow the rate of growth, and then we'll find our inflection point, right? I am hopeful that the state doesn't have to take those actions, but there are certainly a whole host of steps that have been taken so far to try to limit social interaction. So I want to go through a couple more points with you, and that is first, if you have additional questions, even if it's just simple information that you need regarding COVID-19, visit duchessny.gov/coronavirus. Thank you. COVID-19 coronavirus. duchessny.gov/coronavirus, or just go to duchessny.gov. You'll see. You'll be able to click on some information. Follow us on Facebook and Twitter. If you want real-time information from county government, all of that information is sourced, it's consistent, it's accurate, and you'll find it at Dutchess County Government on Facebook. Some of you are watching now, or Dutchess County Government on Twitter. That information is updated. You'll also note, by the way, that you'll see some additional information that about social anxiety, mental illness, mental wellness. So a lot of resources that will be available to you that Dutchess County provides through county government, all there for your assistance. We'll also start to see, for those who might be living at home with individuals who are on the autism spectrum or developmental disabilities, additional contact information that will be useful to you, maybe even some social stories that might be available to you to explain what's going on to those who might have some sensory concerns. So all of that's there. And I will also tell you, with kids being at home and families not necessarily returning to work in the short term, there'll be information and opportunities online that we hope will remind you that we live in a great place. So whether it's some videos of the Trevor Park Zoo at Millbrook or other tourism destinations that we're just not going to be able to visit right now, might get your mind off of COVID and also give you an opportunity for mom or dad at home to kind of maybe give your kids something to do that feels like it's learning. So you'll see a little bit of that. You'll still see a little bit of fun stuff online. So I guess this is, I know, Doctor, you're not a mental health expert, but there's value to public health in addressing sort of the question of normalcy. You want to add? You don't have to, but I'll let you jump in. If you want to talk a little bit about that, and then we're going to, I think, try to organize a close here. But go ahead.
Absolutely. I think it's very important that, again, especially in stressful times, we sort of order our lives in a way that, again, tries to make it as normal as possible, especially having social interaction when we're at home. There are ways to connect to other individuals and not isolate ourselves. We have the technology, and people should avail themselves of that because it's very important.
We agree, and I think it's, as you're watching and listening, you've been on the call. This is County Executive Mark Molinaro. 12,000 of your neighbors across Dutchess County. Of course, hundreds of you here at our Facebook page. If you have additional questions, visit duchessny.gov. I just want to take this opportunity to say this quite sincerely. I know that this is a very stressful time, and it is uncertain for many. And I know that there are probably more questions than there are total answers. But what I can offer to you is that in this community, there are a great deal of resources available to you. Accessing them through social media or through the county's webpage, looking out to the community. There are businesses and organizations who are providing assistance. There are community leaders, faith leaders who are all available. Many of our churches are going online, synagogues going online to provide service and support that way. As I don't mean this to sound at all corny, but I'll offer it nonetheless, and that is there is still a great deal of hope, and we can still be very optimistic that as a society and as a community, we'll not only rise to this occasion, we will weather this storm together. And by leaning on each other, maybe not physically, but emotionally, by providing opportunities to share with one another as volunteers, as givers, as helpers. These are all the things that we will do to ensure that we not only respond, but that we overcome it, and that as a community we grow stronger. So with that, I just want to encourage you to be good models for your kids, to lean on one another and take those opportunities to share what moments we're going to have in close quarters that maybe we haven't had in a while. If there is somebody in your circle of friends or family that is at risk or at need, reach out to them. Certainly lean on DuchessNY.gov as a means to identify resources that might be available to them. And so this is who we are. Neighbors helping neighbors, families supporting families, and people caring for one another. And with that, Dutchess County will rise to this occasion, and I'm confident that together we'll weather this storm. In 2 weeks, we'll have another telephone town hall live with you. Next week, we'll have an opportunity on Facebook Live to provide some additional information, and you should continue to visit Dutchess County Government on Facebook and Twitter, or DuchessNY.gov for additional information. Ladies and gentlemen, this is County Executive Mark Molinaro. I look forward to answering your questions again, and wish you good health, and that we stick together.